The damaged surface of the hip socket or acetabulum is removed and shaped to fit the new artificial component. A new cup-shaped implant is then pressed into the bone and may be secured with screws. A smooth plastic surface is then inserted which will allow the new joint to move freely. The sawn-off head of the femur is prepared by exposing and running out the upper part of the femoral canal, which runs down the middle of the femoral shaft of the femoral canal and creates a hollow into which the new femoral prosthesis is inserted to a depth of about 6 inches or 15 centimeters. When a temporary prosthesis is in place, the surgeon puts the joint back together to check the fit and leg length. If necessary, a longer or shorter final prosthesis can be useful or used to ensure the final leg length is the same after the operation as it was before. Scientists have developed a porous metal surface for cementless prostheses that resembles the honeycomb structure of bone. This encourages rapid and extensive infiltration with natural bone to hold the new artificial component strongly in place. Depending on the design of the prosthesis, the stem of the implant is either fixed in place with bone cement or implanted and firmly impacted without cement. A metal ball is then placed on the top of the stem to act as the femoral head, and this is guided into place within the new socket. The hip joint is taken through the full range of movement to check all is well. The joint is thoroughly cleansed of bone chips and cement, which might cause excessive wear on the new joint. The joint capsule is then closed and the skin wound repaired with stitches or clips. A drain may be left in place to prevent fluid building up around the knee. This is removed after 1 or 2 days. If absorbable stitches are used, these usually dissolve and disappear within 7 to 10 days. Non-absorbable sutures and clips are removed after 7 to 10 days. Antibiotics are given during and after surgery to help reduce the risk if infection of the wound or joint is present. It is now possible to have a hip replacement prosthesis personally tailored to your individual measurements. Your hip is examined using computerized tomography, and a computer builds a 3D image of the required prosthesis. The new hip is then custom made by a computerized milling mechanism that fashions it from titanium. The prosthesis is designed to fit tightly in place, withhold the need for cement, and the two surfaces of the artificial joint are covered with a hard-wearing ceramic liner. Once the artificial joint is inserted, your own bone is stimulated to grow into the prosthesis to hold it in place. Where necessary, a hybrid operation can be carried out in which just one of the components, either the ball or socket, is cemented in place while the other part remains cementless. In this aspect, it is, of course, important to note that exercises are important to strengthen your muscles. As you recover, you will be advised when you can start swimming, walking, and golfing. You must avoid high impacts or contact sports, such as running, jumping, soccer, and basketball. However, you must also avoid activities that involve fast stopping and starting or twisting. You can usually return to work within 6 to 8 weeks. If your job involves a lot of standing or lifting, you may need to take several more months off work. You should not drive until your surgeon advises that you can, usually when you can perform an emergency stop without discomfort. How's that?
It's fine.